name is Enos and this is Work and Wonder. If this is your first time of seeing my channel, please make sure you subscribe to the channel and turn on the notification bell. And anytime I upload a video, you'll be notified and you'll come straight here and take a look at whatever video that I have uploaded. I talk a lot about the mental health Osce. So if you're a mental health nurse who is very much interested in the mental health Osce, that is people who want to practice in the UK as registered nurses with the NMC, then this is the best channel for you. Just make sure you smash the subscription button, and anytime I upload a video, you'll be notified and you'll come straight here and take a look at this video. Usually I do make videos like this, and there's usually something that will prompt me to come and then make a video like this. I know that for the past few days I've not really uploaded some videos. That's because I'm in school and it's a bit hectic, combining that. But then I have a lot of videos that I have shot. I'm still editing and then I'll be uploading. But this one is just a very quick one. So I've noticed a growing trend in people failing in the assessment. And, I've had comments under the video section. I had this scenario, I did this, I did that. But then when it came, I failed. I even contested the results and still, they said that I have failed. And I've noticed something, and this is the mistake I want you to avoid so that you will not fail your assessment station. So now, one thing you should know is that in mental health, our care is very, very, very individualistic. If you look at the various models of cares that we use in the mental health, which may include the MDT, which may include the recovery model of care, you realize that these cares are geared towards the individual. So you can have two people with schizophrenia, but the type of care that we give the two patients are completely different. That is because we are being very individualistic with the patient. We look at the patient needs and then we give the type of care that we are supposed to give. In that same vein, you can have the same scenario, but the type of patient that they are going to present to you, let's just take, for instance, depression with suicidal ideation, both the same scenario. But the patient that they are going to present to you in the exam situation will determine the type of interventions that you are going to render for this particular patient. So if you watch my videos or if you watch any other videos and then you see the person demonstrating how you are supposed to do the assessment, usually the way you are going to do it is the same, but the outcome is going to be different. So don't expect that I did a video on depression and suicidal ideation and these were my interventions for this particular patient, so that is the same interventions that you are going to give to the patient that you are going to get. No, absolutely no. And that is the mistake people are making. Listen to the patient, and then the patient, whatever the patient is telling you, is going to determine your outcome. Mental health is not like physical health. Physical health, just by looking at the patient, you can think of some diagnostics that you can run, and at the end of your diagnostics, you'll be able to determine what type of condition that the patient is having. That is not like mental health. Mental health is more like listening to the patient or listening to the relatives of the patient. They're telling you the types of symptoms that this particular patient is exhibiting. It's also more like you just looking at the patient. When you sit with the patient and the patient has schizophrenia, and the patient is clearly or evidently responding to external stimuli, that is in form of whether it is visual hallucination, tactile hallucination, or whatever type of hallucination, that is a key thing. You just observe the patient and then you can clearly see that these are signs and symptoms that are pointing towards this. But speaking to the patient will let you know more about the patient condition. So in mental health, is completely different from physical health. That is one thing that you should get. And I understand that most of you might not be, mental health nurses. It is just, the little mental health that you studied within your course of study that you are using. So if you are a general nurse who has converted to a mental health nurse, these are some of the specific things that you have to take a look at. So don't make that mistake of saying that the scenarios are the same, so the outcomes is the same. Now, let's look at this. You can have two situations. I can have a patient, the same scenario, then two patients. One patient says, I ask the patient whether the patient is having thought of self-harm, and then this patient says that Well, the last time I had it was like maybe a week ago. Probably within a week it comes, but then it's not, so strong. I'm able to control it, or it comes and then it goes. When I listen to this patient, I can see that I can clearly state that this patient is not eminently at risk of self-harm. But then I have another patient who says that I'm having thought of self-harm. Even yesterday I was having that thought, and as I'm speaking to you now, the thought is just running through my head. Now, you have these two patients. One says that, oh, a week ago, it just usually comes and goes. And another one is saying that just yesterday I had that thought of self-harm. And as I'm speaking to you, I'm having even thought of self-harm. Now, in these two cases, probably there are other things that the patient have mentioned, and then you need to admit these two patients. The admission of these two patients is going to be different. The one that is not having active thought of self-harm but then still needs admission, the way you are going to admit this patient is definitely going to be different from the way you are going to admit the one that says that I have active thought of self-harm. The one that has active thought of self-harm, immediately as possible, you have to admit this patient. And in such cases, you don't say that, oh, let me go and then I'll go and make preparations and then later we'll get in touch and then we'll see how we are going to admit you. By the time you come back, the patient is gone, because the patient is having thought of self-harm at the time you were even speaking to the patient. But then the other one that says, oh, it comes and goes, and you can at least delay his or her admission a bit and the patient will still be fine. So in these two cases, you must know when to immediately admit the patient. So it's in the second case, you have to sit with the patient until because immediately you make arrangement or you make a call to the A&E that this patient is this. Immediately as possible, they are going to find a bed for this particular patient in the acute ward for the patient to be admitted, because they understand that if you leave the patient is likely to self-harm. By the same vein, if you call the A&E and tell them this, they will tell that, oh, this patient, we can actually admit maybe tomorrow or tomorrow next, because this is a patient who is not having active thought of self-harm. So please get the difference. The patient presentation will determine the type of immediate intervention that you are going to give. So the patient presentation will determine the immediate intervention that you'll be giving. Either the patient needs to be admitted right now, or the admission can be done even the next day. So please know the difference. And in the case where you need to immediately admit the patient, then you have to sit with the patient until the arrangement is made, because if you leave the patient there, the patient is likely to self-harm. So please, let's take note of this, and when we are doing our assessment, we would be very individualistic. We don't say that this video, this person did it this way, so that's the same way I'm going to do it, and that's the same intervention that I'm going to give. No. As I said, in mental health, our focus is usually, or our models of care is usually very, very, very individualistic. As a bonus, please go and read on the MDT model of care, go and read on the recovery model of care. There are a couple of them that in my subsequent video I might put out for you to know the type or the models of care that we use in the mental health setting. So that is basically it. Your patient presentation determines the kind of so that's basically the video for today. My name is Enos and this is Work and Wonder. I've seen all your comments, the type of videos that you want me to make, and as I said, I'm a bit very tight right now, but then I'll make sure that most of the videos I'll try as much as, especially the intramuscular practical video. Now I've got my tunic and other things. I was waiting for some tunic and some other things that I ordered from eBay, so that I'll be able to practically demonstrate it for you to be able to know how exactly it is done. I've got it now, and then over the coming weeks I'll make sure that I actually do it and then upload it for you to see exactly how it is done. Until then, please make sure you subscribe to the channel, turn on the notification bell, and anytime I upload the video, you'll be notified and you come straight here and take a look at the video. My name is Enos and this is Work and Wonder.